So our next speaker, Beau Hwang, is a senior at UCLA majoring in gender studies with a minor in public affairs. Beau overcame extraordinary hardship to gain admission to UCLA. He's a former homeless youth who lived in the streets of Hollywood. He graduated high school at the age of 16, and after attending Los Angeles City College for 5 years, he transferred to UCLA on a full-ride scholarship. Beau believes in the power of mentorship and storytelling as a way to heal from trauma and from hardship, and to form allyship. Today, Beau will share his story titled A Cultural Humility Lens to Reducing Health Disparities in LGBTQ Communities. Please join me in welcoming Beau Hwang.
Awesome. So before I start my presentation, I really want the crowd to please give a round of applause to the folks that made this conference possible. So that's me at my high school graduation. My name is Beau Hwang, and I'm extremely humbled and very honored to be chosen as one of the undergraduate speakers. So I want to take y'all back to when I was a baby. So there's me, baby Beau, versus adult Beau. So what was the difference between baby Beau versus adult Beau? He was curious. He asked questions. But what about Beau today? I have set beliefs, and I make a lot of assumptions. So what happened? What happened from being a baby to an adult? Was it education? Coming out of the closet as a queer trans guy? Or was it fame? But the cool thing was, just like one of my favorite singers, Sam Smith, says, I'm not the only one, was that I wasn't the only one that had biases and stereotypes. It was also physicians who made stereotypes about my gender presentation, my gender identity, my sexuality, my past drug history, and even my sex life. But it wasn't just healthcare professionals, it was my peers and my coworkers. So I thought, hey, it's okay to have assumptions, to have biases and stereotypes, right? That's just the way we function. We function having binaries, right? It's okay, right? Let's all admit it, right? We all have prejudice. Well, not really. Those prejudice actually leads to one of the biggest issues in the LGBTQ communities is also health disparities. The way we start, the way we think about certain communities can actually lead the way that we show up. So this led me to the topic of cultural humility by Dr. Trevor Long and Dr. Maria Garcia, where I know the past speaker just spoke about cultural competence. Well, here, I'm about to show you a different lens, a different approach. Cultural humility, there are three aspects. The first aspect is it's a lifelong learning. A lot of folks, I recently took an LGBTQ ally training. It was a 2-hour training. Other folks felt like, yes, I know everything about the LGBTQ community, and they felt ready and prepared. And even myself, who identifies as a queer trans guy, know for a fact that I don't know every aspect of my own community. So it's a lifelong learning. It's not just a completion like, yes, I understand your community, but it's more like, I know this much, but I know that I don't know this much, so I'm willing to hear and listen. Cultural humility is the ability to look at yourself in the mirror and be like, I don't understand. Can you please explain to me? On the other hand, cultural competence, hey, I've dealt with folks from your communities. This is exactly what you need. Best analogy, Kobe Bryant. He never passes a ball. That's cultural competence. I know what I'm doing. I got this. Folks that say I'm open-minded tend to be most closed-minded. Do you know why? Because they're like, no, I get it. You're preaching to choir. I got this. Cultural humility is that actually when Kobe Bryant passes the ball. Second aspect of cultural humility is we understand that healthcare professionals have a breach of knowledge. Yes, that's a fact. But guess what? The client also has knowledge about their own history, about their own communities, and what works and what doesn't. So if we bring scientific knowledge with personal knowledge, then we're building teammates, and not just, in this case, what it says is, when we want your opinion, we'll give it to you. The last aspect of cultural humility is keeping the institutions accountable. Recently, I volunteered at one of UCLA's hospital, and they had a restroom. They had a male restroom and a female restroom was single-stalled. The male restroom didn't work, so the male-identifying folks did not feel comfortable going to this female restroom that it literally just looks like a person wearing a lab coat. It looks nothing like a woman. I made a sign that says gender inclusive restroom, and the nurse came up and said, this is super uncomfortable. Why do you have this? Let me take the sign out. But I said, no, it's just a sign. If you keep institutions accountable, creating a more gender inclusive language, asking your clients your preferred name, pronouns, rather than referring to folks as guys, what about y'all? Or what about referring to clients as clients and not patients, because patients sounds as if they will always be sick? What about, we traditionally call individuals who are physically, with a physical disability, we say they're disabled. But what if I was to tell you that we as a society make them disabled? Why do we have stairs and elevators and not create more ramps? And rather, what if we call them differently abled? You see, the language is not just about being politically correct. Politically correct is pretty, but the thing is, it's your starting point on how you think. I think medicine, we tend to focus on the able body, this image of this normative body, and everyone outside of that body is considered pathologized or different. What if I was to tell you that some people don't want to be cured, that some people, there's not a treatment? Then why do we label them as being different? It's the starting point, I believe. Because as we strive for diversity, inclusivity, and equity in medicine, all profession, we have to accept the fact, sure, we want the community to be diverse. We want gay people, white people, yellow people, Korean people, yes. But diversity is just the starting point, because diversity is barely inviting people to the party. On the other hand, inclusivity is actually inviting them to dance at the party. So let me ask you something. You're invited to this conference, right? How many people felt welcome during lunchtime? How many people felt welcome when the speakers are talking and when you're doing Q&A? Did you feel inclusive? Did your opinions, did it felt like it was being heard? Or your thoughts? Now that's what we're striving for. And you say, okay, Beau, that's great. You gave me theories and all that. I want to know the real thing. How can I make my clients feel more safe and more brave? Well, guess what? Simple things. Having a sticker, rather it is in your folder or in your office, LGBT ally, having a pin. And you can, okay, great. I could do that here in LA and wherever in my office. Now I want things globally. How can I take this cultural humility lens to the global aspect? Well, if you were to have a cultural humility lens and you were to go somewhere, Uganda or South Korea, and you meet a client, then you know for a fact that each individual is very complicated, just like these arrows that we have. It's intersectionality. It's like, for example, you can't use my story and be like, all trans folks go through sexual trauma. No, there's an aspect of all my stories and all my identities. But if you were to use a cultural competence lens and examine me, then you make biases and stereotypes about my life. So I challenge everyone, just like my baby picture here, to really think like a baby, ask questions, and really not to make generalizations. I think we tend to do this all the time. And it really shows up in our workplace. And really be curious and not be like, no, you're preaching to the choir. No, I want to listen. I'm here. So I challenge everyone here today. If you really like what I talked about asking questions, really have your curious mind, keeping your institution accountable, and starting your starting point from really that curious mind, then I ask that if you could please rise from your seats and you join me as I end my presentation with a unity clap. A unity clap was a way for the Hispanic and the Filipino farm workers to come together. And in the end, despite of their language barrier, what they knew was they wanted to create unity and allyship. And this is what I strive for global health, not just to help the vulnerable population, not just my communities, but also other communities as well. So please join me as I end with this unity clap. Thank you very much. Have a wonderful day.